We want to get everyone caught up on the latest on the coronavirus. Overnight, the governor of California issuing a strict stay-at-home order to his state's 40 million residents, warning more than half of them, could become infected in the weeks ahead. The State Department is out with a new warning as well, telling all Americans to avoid overseas travel. And anyone who's already out of the country, they say, should get back now or they could get stuck. Meantime, the dire situation in Italy only getting worse. Its death toll now the highest in the world, surpassing China. And with more testing underway, there has been another dramatic rise in U.S. cases, now more than 14,000 with 206 deaths. Okay, we're going to walk you through all of this. We're also going to talk with Dr. Anthony Fauci, a key member of the government's task force. But first, NBC national correspondent Miguel Almaguer has the latest from L.A. for us. Hey, Miguel, good morning.
Hoda, good morning. The governor of California says it's a matter of time before tens of millions of people catch the virus here in California. It's a sobering statistic. Every other person becoming ill, and California may not be the only state with similar projections.
This morning in the nation's most populated state, all residents are now ordered to stay at home.
We need to bend the curve in the state of California.
California's Governor Gavin Newsom issuing the order overnight for the state's 40 million residents.
As individuals and as a community, we need to do more to meet this moment.
This after warning that more than half of those who live in California could become infected with the coronavirus over 8 weeks. The action following this letter to the president, projecting 25.5 million people in the Golden State alone might contract the illness. Newsom is requesting $1 billion in federal funds to support the state's medical response to COVID-19.
Today is a day that will be seared into the story and the streets of this city.
With ghostly scenes like these unfolding in New York, Boston, and San Francisco, in the nation's second most populated state, Texas, the governor there now ordering the closure of dine-in restaurants, bars, and gyms, joining a growing list of states and cities restricting groups larger than 10 people. Maryland's governor issuing a blunt warning to those not taking the crisis seriously.
You are endangering the lives of your fellow Marylanders.
32-year-old Matt Schulte has had the virus for more than a week.
I'm like short of breath, so sometimes I just have to, and then it's just a heaviness. It feels like my lungs have fluid in them.
At the end of a long week, which millions of Americans have spent at home, this morning a reminder, in this crisis, we are all separated together.
Amid that dramatic warning from the California governor that millions and millions more could get sick, he has also asked the president to dock the USNS Mercy, a large floating hospital at the Port of Los Angeles, another indication of how bad this crisis is expected to become. Savannah?
All right, Miguel Almaguer leading us off. Americans all across the country are eager for financial relief as well. And on Capitol Hill, negotiations on a $1 trillion plan are intensifying. NBC's Tom Costello working from home as well once again today and has that part of the story. Tom, good morning.
Hi, Savannah. Good morning to you. Lawmakers are trying to expedite financial aid to the country, to general Americans out there. And they are meeting today in the Senate to try to move that through. Meanwhile, the FDA is looking to expedite drug treatments that may work. And at least one drug is showing some promising early signs. But the FDA cautions all of this is in the early stages.
The federal response to the coronavirus is entering a new phase this morning, with President Trump pushing the FDA to fast-track possible medical treatment for the disease, and lawmakers on Capitol Hill anxious to fast-track much-needed financial help.
These are urgent discussions. They need to happen at a member level, and they need to happen starting right now.
Senate Majority Leader Mitch McConnell unveiled the Republican plan Thursday that would provide direct payments to Americans. Based on 2018 tax returns, people making less than $75,000 would receive $1,200 each, while anyone making above $99,000 would not get a check. The measure would also provide relief to businesses and provide more support to healthcare workers.
We know this legislation will not be the last word.
Doctors, nurses, and technicians in some hard-hit states like Washington State are now running out of supplies.
We may be reusing masks and trying to conserve things like the respirator hoods.
The shortage of supplies in some areas has the CDC recommending doctors and nurses use homemade masks or even bandanas as a last resort. Meanwhile, President Trump touting two potential treatment options that the FDA is looking into: an antiviral called remdesivir and chloroquine, which is used to treat malaria.
Essentially approved for prescribed use. And I think it's going to be very exciting. I think it could be a game changer, and maybe not.
But the drugs are not approved yet, and the head of the FDA says getting there will take time to ensure they're safe and that they work.
We need to look at it. We need the data. We need to make sure that the sea of new treatments will get the right drug to the right patient at the right dosage at the right time.
It all comes as the State Department issues new guidelines telling Americans not to travel abroad, and for those already overseas, return immediately. The question this morning: how long will America's new reality last?
When can Americans expect their lives to go back to normal?
I hope very soon. We'll see. This is uncharted territory.
Yeah, the vice president, by the way, is also saying that now that private labs have joined the testing effort for COVID-19, the number of tests being processed every single day has jumped dramatically, thousands of tests every day. And the president says that hard-hit Carnival cruise ships is now offering to allow at least one or more of its ships to be used for floating hospital purposes. Savannah?
All right, Tom. Thank you very much. And we are joined now by a key member of the government's coronavirus task force, Dr. Anthony Fauci, who is the director of the National Institute of Allergy and Infectious Diseases. Dr. Fauci, good morning. Good to see you, sir.
Good morning.
The urgent matter this morning appears to be this matter of healthcare supplies. We've seen it on the front pages. We've seen it online, on TV. Doctors literally begging for equipment, which affects, of course, not only who they can treat, but whether they can even do these tests. How dire a situation is it if the CDC itself is suggesting maybe you use a bandana if you don't have anything else?
Well, I mean, obviously, when you have a seriousness of an outbreak the way we're seeing right now, there's going to be a significant stress on supplies, and that's what we're seeing play out right now. One of the things that can be done, it's certainly not the total solution to the problem, is to delay, if not cancel, anything that's elective. I mean, any medical or surgical procedures that need to be done on an elective basis should not be done in anticipation of the fact that beds and equipment that you would use even in an elective situation should be used for people who really need it. Even though you don't see that now in certain locations, pretty soon there's going to be a stress on everyone's system, and that's one of the things that can be done.
Yeah. I mean, we've seen these disturbing anecdotes, Dr. Fauci. One Seattle area hospital setting up its own makeshift assembly line using parts purchased from Home Depot and craft stores. The president says that he has invoked, in fact, he tweeted, he said, "I only signed the Defense Production Act to combat the Chinese virus should we need to invoke it in a worst case scenario." Now, that Defense Production Act essentially enables him, if he wants to order private manufacturers, private business in this country, to help out and start manufacturing some of this stuff. He said he's only done it in a worst case scenario. Are we there? Is it time to actually act on it?
You know, literally every single day, multiple times a day, this is brought up and discussed. I mean, I don't want to get ahead of the president, but I can tell you he's very serious about doing everything we possibly can do. We're going to meet again today in a couple of hours, and I'm sure this is going to come up front as something of a very intense discussion.
What do you think? Is it time? What would your recommendation be?
No, I think we should do everything we possibly can do. I mean, in all sectors, because obviously, as I've said so many times, when you think you're maybe overreacting, you probably are not acting as forcefully as you should. So as we've always said, we've got to try very much to stay ahead of the curve.
Yeah, I mean, I guess it's just that, just to put a fine point on it, if doctors are resorting to going to the craft store to come up with their own equipment to protect themselves, and we anticipate how badly we need them, isn't that kind of the worst case scenario that the president's talking about?
Yes, I mean, obviously it is. You're speaking the obvious. I mean, obviously we are in a very difficult situation, and we should be doing everything we possibly can to mitigate that.
Let's talk about some of these new therapies, new drugs that the president talked about. He said they were exciting, that the FDA has approved them. I'm talking about, I guess, and you can pronounce it better than me, hydroxychloroquine and chloroquine, which have been used in the past for malaria and for rheumatoid arthritis. First of all, has the FDA approved them for use for this virus? Do they work for this virus? Should doctors just go out on their own right now and prescribe them?
Well, I think the commissioner of the FDA, Steve Hahn, said it very well as the president yesterday, that these are drugs that anecdotally, without being done in a controlled trial, have some suggestion that they might work. We're getting stories from people who've tried them, but they've tried them in trials that are not controlled. So what we're saying is that we want to make them more available, but in the context of a protocol of some sort that would not only make them available, but that we can get some information as to whether they're safe and whether they really work. Because even though the information is anecdotal that they may work, we need to prove it so that people will get the right drug that's safe and effective. That's what the FDA was talking about yesterday.
Okay, so there's hope, but we're not there yet. Let me ask you about the virus itself. I mean, fundamentally, this is a novel virus. We've never seen it before, so we're all learning about it at the same time. There have been reports that the virus may be hitting the younger population more seriously than previously described. The CDC in particular says of the hospitalizations in the U.S., 38% were people between the ages of 20 and 54. Is there a new consideration that perhaps this is hitting the young more than was initially thought?
Right. You know, that is quite possible. There are a couple of things you want to look at. You want to find out if the people who are young and getting what we say hit more now have underlying conditions or not. If they don't have underlying conditions, many of them do, then we really got to carefully look at that data, because if you look at the data from China and some of the data that we've seen early on, clearly younger individuals had very little involvement of any seriousness. If this is true, which it might be, we have to relook at that and make sure. Another reason why, when we say young people should not consider themselves invulnerable, they should be doing everything they can to protect themselves from infection, not only for themselves, but for the possibility that they may pass the infection on to someone who's really vulnerable, like an elderly person or someone with an underlying condition.
Absolutely, Doctor. We've said many, many times that as far as we know, the telltale signs of COVID-19 are that shortness of breath, a fever, the coughing. Now that it's here and you're starting to get information from American doctors, is it presenting with other symptoms such as a runny nose, a sore throat? I mean, are you learning more about how this virus is appearing in patients in this country?
Yes, I mean, of course, the more patients you see, the more you learn. It really is somewhat of a confirmation of what we've seen from our colleagues in China and now in Europe. Generally, it is not an upper airway disease. That doesn't mean that no one will ever get an upper airway type of involvement. But if you have an itchy eye and a running nose, that generally is not associated. I mean, I've spoken to people, my colleagues who've been infected, and it's pretty consistent. They get fever, they get achy, they get a flu-like syndrome, they get a cough, they get a little bit short of breath. It isn't really a predominance of upper airway symptoms.
Let me ask you before we go about testing. That has really been this persistent issue with regard to the response. Certainly, there's more testing than ever before in this country. You had famously acknowledged it when testing was failing. How do you grade it now? Are we where we need to be, or does more need to be done?
No, clearly more needs to be done, but we are rapidly getting to the point where we will have many, many tests out there available for virtually everyone. Early on, as I've said, it wasn't the way it should have been, but we're really now very much in the right direction, flooding the system with it. There are going to be people, for sure, who will call in and say they can't get tested. It's not a perfect system yet, but we're getting there very rapidly.
Real quick, here's the question that everyone wants you to answer, and I don't know if you can, sir, candidly, but we're all at home right now, including me right now in my basement. How long do you think that Americans need to be in this posture of staying at home and avoiding other people for it to work?
Obviously, that's obviously the question that everyone is asking. If you look at the trajectory of the curves of outbreaks in other areas, it's at least going to be several weeks. I cannot see that all of a sudden next week or 2 weeks from now it's going to be over. I don't think there's a chance of that. I think it's going to be several weeks.
All right. Dr. Fauci, I know you're busy. We so appreciate your expertise and being with us. Thank you very much.
Good to be with you as always.
All right, we'll send it back to Hoda now.
All right, Savannah, thank you so much. Just ahead, the mayor of Los Angeles. He'll join us live with what California's unprecedented new stay-at-home order means for the millions of people in that city. But first, back to that shortage of basic medical supplies at hospitals around the country. Some help is on the way and kind of from an unexpected source. TV medical dramas, those shows, they're donating their unused masks, gloves, gowns, and other supplies to hospitals and fire stations. Production, of course, is halted on a number of these shows because of the outbreak. One doctor wrote on social media, "This kind of community support means so much to our front line providers."